Hi, I'm here with Rob from Cresset. Rob, thank you very much for joining us.
Thank you.
Could you please introduce yourself and tell us a little bit more about what you do at Cresset?
Hi, I'm Rob Scoffin. I'm the CEO of Cresset. I've got a background in computational chemistry from Oxford University. And then for 30 years, I've worked in computational drug design and cheminformatics with a variety of companies. This is my third sort of large-scale company that I've worked for. And at Cresset, nowadays, I'm mostly responsible for strategic direction and overall operational management.
Thank you. So tell me a bit about Cresset's growth and expansion plans following the investment you received last year.
Thank you. Yeah. So we closed an investment round in September of last year. And we've been growing for the last 10 years, growing about 20% year on year as a business. And we felt that there was more growth was possible. So taking on the investments really enabled us to underpin what we were already doing. So it was really an acceleration of plans rather than a change of plans. But that's really helped us now to bring forward some recruitment. So we've effectively doubled the team since February of last year. We started February of last year with 60 people, and we're now more than 120 people. And that was really, a risk we probably wouldn't have taken without the investment to go to that level of growth. And so that's probably accelerated the business by at least 18 months to 2 years in terms of where we wanted to get to, the progression we wanted to make. Yeah.
So working with students and academic researchers is important to foster a climate of innovation and knowledge sharing within the sector. How do you feel industry and academia can work together more effectively?
Yeah, it's quite a key area for us particularly. I think as a technology business, it's often easy to underestimate how much value there is in the people that are involved in the business. And so when we're thinking about innovation, we're always thinking about the new talent that we're bringing into the business. And of course, a lot of that talent is recruited from universities. So we hire a lot of PhD students. We also collaborate quite extensively with a lot of academic groups that are working in the right kind of areas, both from a method development, from a computational chemistry perspective, but also from academic drug discovery as well. So providing us with a way to test what we're developing in a real world situation. So to have some key collaborations that really enable us to know that what we're developing is good and scalable. And so, those trends of deeper collaboration have further been enhanced by the funding. It's enabled us to obviously hire more people, but it's also enabled us to fund more collaborations, particularly across into academia.
So lots more to look forward to.
Absolutely, yeah.
So what are the biggest innovations taking place in computational chemistry and how will they disrupt the sector?
Yeah, I think there's probably three things that I would look at and that you can sort of categorize them as sort of near-term things that are happening today. So the one I would sort of highlight there is free energy method. So there's a method called free energy perturbation. It's been around for 15 years, but has really gained currency over the last 5 years. With the growth in compute power has meant that by simulating a large system, biological target and small molecule ligand, you can accurately predict the efficacy of your compounds without actually making the compound. And that's always been a goal. So the 30 years I've been sort of working in the industry, that's always been a goal, to get to that kind of reliable prediction. And FEP is the latest in a long stream of promising technologies, but actually it really does sort of break that mold of making those predictions faster than you can make the molecule, and you can test the molecule with a biological screen. So that's the sort of near term. It's been quite disruptive in the way that computational chemistry interfaces into drug discovery. The second is AI, obviously, and there's a lot of sort of conversation about AI, and we've seen sort of two areas of disruption. So one area is that sort of AI can solve all the world's problems, in a heartbeat kind of push. And yeah, there's a lot of fluff in that, but there's always a grain of truth in those things, that whilst AI isn't going to solve all of the problems, and you aren't going to be able to go from computer to patient, in 6 months because you used AI, what we're finding is that by applying those AI approaches, we can massively speed up how we do our computations in some very key areas. So where something would take hours without using an AI approach, it can take less than a second with an AI approach. And so it opens up lots of opportunities to apply those methods to either more things, in some more projects, or to just bigger and bigger numbers of molecules that open up the world of kind of novel chemical spaces. So that's kind of tomorrow, I would say. Okay. It's somewhat being applied today, but it's really a tomorrow technology. And then quantum computing is the one that's kind of sitting out there in a 5 to 10 year time frame that will again radically alter the level of computation that you have available. That means you can simulate systems that are much bigger and much closer to reality. Mm-hmm. So this sort of dream of having a sort of a true physics-based simulation of what's happening in a full biological system, which we can't do today with the compute power in any meaningful, tractable way in drug discovery. You can do it academically, but not sort of if you want to do something about it. That will become true. And so that's my kind of, not next week, but in a couple of years' time, technology.
Perfect, thank you. So as we just mentioned, one of the key technological innovations affecting the sector in recent years is computational drug design. What has been its effect to date, and how do you anticipate it affecting the industry in years to come?
Yeah, I think there's an acceptance today where, as I mentioned, I'm quite old. I've been doing this for 30 years. When I first started, I had to work very hard to persuade people to adopt computational methods.
Okay.
Because largely they were right. They could do the chemistry and the biology faster than I could do the computational chemistry.
Right.
And so I was always answering a question after they'd already answered it themselves. So I could justify, right, I told you so, you were right. And I could explain why something worked the way it worked, but I wasn't ever ahead of the curve. And that's changed. So roll forward sort of 30 years and computer-aided drug design in small molecules, it is accepted pretty much everywhere. It's a standard tool, everybody uses it. And it's similar to what we mentioned about AI. A very wise person, it wasn't me, a very wise person once sort of said at a conference, will AI remove the need for medicinal chemists? And this is no, probably not, but it'll, a medicinal chemist who uses AI will remove the need for a medicinal chemist who doesn't. And that's sort of, it's a tool that you use, and if you use it effectively, it's really good. And I think where we're sort of on the cusp is actually on the other side of the fence in the biologics space, where computational approaches are still at the kind of justify, what you did and why it works. So we're slightly, the methods are slightly behind the curve. And that's changing quite rapidly to the point where prospective computational design particularly of antibodies makes sense to get to a product that's developable rather than just an antibody that's effective. That's, it's not the easy bit, right? It's not, none of it's easy, but it's easier with antibodies to get the specificity and the activity, but getting to a molecule which is able to be developed into a product is much harder, and that's where the computational approaches are starting to come in. So that's an impact. I think CAD has strongly impacted small molecule discovery just in terms of it's a tool everybody uses. That's where it'll be sort of over the next 5 years. I think you'll see that in the biologic space as well.
So we're living through times of unprecedented change in the biotechnology and biochemistry sector. How has Cresset navigated these changes as a business and on behalf of its clients?
Yeah, so I think there's sort of a couple of different things behind that. So obviously over the last 4 years, we've gone through massive societal change in terms of how we work because of COVID. And so that's really changed the way that we've approached as a business, providing both our own internal resources, our development resources, our science research staff, but also how we interface to customers. And so adopting a much more remote working strategy, but having different products and different tools that work in those contexts much better. So moving, for instance, moving more of the tools into the cloud so that they're accessible wherever you are. You don't have to be inside the lab, inside the sort of firewall of your company. And so those things are sort of changing quite a lot. And I think the other side of it is being, mentioned the sort of biologics and computer-aided design becoming a much more important part of that. That's a massively exploding area in terms of the different modalities. So not just antibodies, but therapeutic peptides and therapeutic proteins, where it opens up a vast new array of opportunities. Of hitherto sort of very hard to drug targets suddenly become accessible. But understanding and predicting and being able to be prospective about how you design something in the same way that we are with small molecule drugs to a large extent, that's still not there. And that's a big sort of, I guess, scientific change in the general industry that we're as a company having to react to by changing the products that we provide and doing more research and doing more collaboration with academics and trying to build the networks up.
Fantastic. Well, Rob, it's been a pleasure speaking to you. Thank you very much.
Thank you very much.